What is the disagreement on the current funding bills? Here are the Neuts. The Senate version of the funding bill would repeal a key subtitle of the One Big Beautiful Bill, or BBB. Last time, we covered 6 core sections of this subtitle highlighted on the speaker's website. But that's only 6 of the 33 sections that would be repealed. This is a high-level overview of the rest. If we'd like more detail on any point, let us know. Here is what the BBB sections did. On eligibility and coverage, it shortened how far back coverage can apply before a Medicaid or CHIP application, moved some adults on Medicaid to 6-month renewals, raised the home equity limit for long-term care eligibility, and added a Medicaid work or community engagement requirement for most able-bodied adults. It also limited certain abortion-related reimbursements for 1 year, narrowed the FMAP incentive to early expansion states, and standardized cost-sharing rules beginning 2028. On Medicaid financing, linking managed care payments to Medicare rates, setting new limits on provider taxes, requiring budget-neutral certifications for state waivers, and funding expanded home and community-based services. On Medicare and tax provisions, it granted a 1-year, 2.5% Medicare physician payment increase for 2026, broadened the orphan drug exclusion from price negotiation, tightened eligibility verification for premium tax credits, removed repayment caps for excess credits, and permanently expanded HSA flexibility for telehealth, bronze-level plans, and direct primary care arrangements. On Medicaid administration, the BBB paused 2 2023 CMS rules, one governing Medicare Savings Program eligibility and another governing Medicaid and CHIP enrollment, delaying both sets of modernization standards until 2034. At the same time, required HHS to build a national data matching system to detect duplicate enrollment and keep address information accurate. On oversight and integrity, the bill required quarterly checks against federal death records, set new standards for confirming provider deaths, and expanded how payment errors are measured starting in 2030. Finally, it created a 5-year, $10 billion per year rural health transformation program to improve rural access, workforce, and technology. In short, the BBB restructured parts of Medicaid administration and oversight, setting new federal standards in some areas while pausing other CMS rules that were already issued. If Congress repeals it, those paused rules could move forward again, and the statutory changes the BBB added would be removed. That's your high-level breakdown. Follow Neut, your source for clear, fact-based legislation breakdowns.